So they started out as a primary care safety net, but that they do take a nice holistic approach that branched out quickly into mental health services and dentistry, and various health centers can specialize in different service provision based off their patient population. And another really cool little factoid about health centers is that 51% of their governing body has to be patients. So if the patients, and it has to be representative of the patient population that they serve, which they take inventory with every year when they submit their grant report to HRSA. They see who they're serving and see what their needs are, and that has to get evaluated by their board. So it's really quite unique. Every health center is a little bit different because they're serving patients based off that need, and that's the agency that those patients have sitting on that governing body and telling the health center leadership what they need. So they wind up looking a little different, and how they wind up, how the two venues that we found from my research and how they provide access to prescription medications for uninsured people specifically is the HRSA 340B program, which gets discounted drugs at a price through contracting with HRSA for patients at health centers, as well as disproportionate share hospitals, but we focus on the health centers, the primary care access through either retail pharmacies or direct service provision. The health center can run a pharmacy itself, so it's especially helpful in more rural areas where that might be harder for a patient to access even a Walgreens. And then also there's the drug assistance programs, which are the health centers have become very adept at utilizing the like discounted drugs and free drugs that the pharmaceutical companies and manufacturers provide directly to as a kind of a good service to the world that they apply for, and then do eligibility assistance for their patients and make sure that they can get access that way if they don't have access through their insurance or a 340 program. So both methods at the same time usually is what we found.